So I am going to present about applying systems thinking in health and climate change policy making. And as part of this presentation, more than the content, I'm more focusing on the methodological part because this is the project funded by WHO Alliance for Health Policy and Systems Research. And the objective of the whole initiative is not just to identify the content, but actually to check how health and climate related policies at federal level, provincial level, and local level are being generated by applying systems thinking. And when we talk about system thinking, many people, including many of us, do think that this is just a concept, and there is no understanding of different kind of tools that can be used to assess, to identify priorities, and to guide policy making process. So because of that, there was a team jointly from the Ministry of Health and Population, so you can see them in the list of co-authors, and from HOD International, and we sat together and developed this project and implemented this project. The data analysis is still progressing, so the content that I'm presenting today is focusing mostly on the methodological part of applying system thinking tools and approaches in policy making. As most of us already know, Nepal is very vulnerable. Based on the Energy Gain Index, Nepal is ranked 139 out of 182 countries. So that reflects that we are in a very vulnerable country in terms of exposure, sensitivity, and adaptive capacity. And that indicates that we really need to be very careful in terms of developing climate and health-related policies in our country. We do have various policies, strategies, and action plan. So Nepal is kind of known for developing good plans. But when we actually see that in implementation, as the previous speaker already highlighted, the implementation part is quite weak. So we really need to think why there is gap between the policy and its implementation. And we need to kind of bridge the knowledge gap on climate health impacts and strengthen health system by early planning and by applying different strategies so that our system is resilient and we will be able to protect vulnerable populations. So looking from resiliency perspective and from equity perspective. So keeping this in our background, we actually discussed among ourselves, the team of researchers and policymakers from the Ministry of Health and Population. And we thought why system thinking would be a better fit in this scenario. So with that idea, we explored different literatures. Many of us were actually applying system thinking related tools and approaches in previous projects, and we thought that this would be the best approach to go forward. And the proposal was developed in that aspect. So applying system thinking or checking Nepal's policy documents to see if they have applied system thinking. What is the readiness to apply system thinking if somebody wishes to apply for any federal, provincial, and local level policy making? So that was the rationale behind this study, and we actually assessed that throughout the project. So the objective was to assess stakeholders' understanding of system thinking concept and tools. Because there are various jargons or terminologies that we use frequently, but many people do understand and interpret that very differently. So the idea is to really understand what people really think or understand when they talk about system thinking. So that is one aspect. So the idea is not only to look into the content of health or climate change, but actually to see when they talk about system thinking, what they are referring to. Do they know about different tools that can be applied, that are used in different contexts, and are they being used in Nepal's context at federal level, provincial level, local level? And then we actually kept these three documents as the reference documents to look into. But these documents are federal level documents, so relevant and provincial and local level documents are kind of associated or are connected as the part of these documents. So in terms of the method, we applied critical systems thinking approach, which is a tool, which is a method to assist decision makers to better understand and address complex issues. And health and climate change is definitely a very complex issue to understand. And when we interacted with different stakeholders, many of them say that, oh, people talk about climate change, and I really don't know how it affects health. And when I ask people, they say everything is related to climate change. And this is very difficult for me to understand if everything is related to climate change. So that was the kind of situation that many of the stakeholders actually reflected. And as part of that approach, we actually used three system thinking tools. And when we introduced this tool, many of them were using those tools, but in a different way, and they really didn't understand what these are really about. The first tool that we used was a boundary critique, which is to identify stakeholders in the area of influence that they can have. So what is the area of influence of Ministry of Health? What is the area of influence of Ministry of Environment? What is the area of influence for provincial government, and so on. So kind of understanding stakeholders, but not just mapping them, but also understanding how much they can influence. Who is more influential to the Office of Prime Minister, to Planning Commission, while developing national policies and so on. So that was the first tool that was used. The second one was group model building. So kind of identifying causal loop diagram and understanding that complexity. So how can we help people to understand the complexity? So using group model building was the second tool. And the policy blueprinting, as we are developing, especially in this federal context, lots of provincial and local government are developing policies, but are they really following? What is the process that they follow? So understanding the blueprint of the process that they follow and identifying what are the opportunities to enhance the policy making process, to make it more relevant to the context, to make it really practicable and implementable. So these three tools were used, and as different tools are used in combination, so methodological pluralism was there. So we had stakeholder consultation at federal level, at provincial level, and in selected local level. So that was the methodology that we used. And when we were doing this, many of the people were saying, when you talk about research, I thought that only key informant interviews or questionnaire or focus group discussions are the only tool. Can a workshop or the mapping a diagram can also be a research tool? So people are really thinking about kind of just the traditional tools and approaches that are being used. So that was what was used. We received ethical approval from NHRC. NVivo, VENSIM were used as a methods. So in terms of findings, so there was limited application because many people didn't really know about the availability and applicability of system thinking tools. So conceptual understanding and practical understanding of how to use it was lacking. So there is policy to practice gap, which we already discussed. So there are policies in place, and policies are mostly written in papers, but how to implement it, what are the additional tools required, so that was lacking. Data use exists to some extent because we do have lots of data, but the integration, interoperability between different sectors is really lacking, so that's a big gap. Capacity enhancement and greater engagement is a critical need. We need to really engage people from different sectors, not just from health, also from environment, also from animal husbandry. So one health approach, all of that has to be applied. So when group model building, so there is a diagram that we created as part of the group model building exercise. So that helped to explain how climate and health are interrelated and where are the levers to change. Potential areas that we can change. What are the areas that... So the exercise was not just the output of this diagram, but it actually helped participants to understand where can we influence, what are the areas, whom to kind of approach to make those changes. So for example, one participant said that climate resilience in health is not achieved through siloed intervention. This exercise helped us to understand complexity, role of different sectors, and potential areas to intervene. So that reflects the importance of these tools. Policy blueprinting, so you can see one sample policy blueprinting from the local level. So we actually asked them, how do you decide which policy needs to be developed? And actually most of the stakeholders said, either the MOFAGA would ask us to prepare something, then we'll prepare it, or there would be some expert from NGO or any development partner, then we'll develop. So actually developing policy based on the need is very minimal. So in which area do we need to prepare the policy is a critical thing that we need to have discussion. And as the chair asked to the previous speaker, engagement of local stakeholders is very minimal. And when we ask, we have political representatives, they speak on behalf of the community. Why should we go back to the beneficiaries community to ask about? So the lack of community engagement, beneficiary engagement is a critical gap in policy making process. So we just didn't develop the blueprint that actually helped us and stakeholders to understand importance of engagement of various stakeholders at different stages. So the conclusion is that system thinking as a research methods remain underutilized and weakly institutionalized. So parts of some pieces were used, and sometimes people try to justify, we have been doing workshop with stakeholder, and that's a system thinking. So it has been used very loosely, So we really need to kind of build capacity of stakeholders in terms of understanding and helping them to understand which tool would be the best one to identify policy making process and integrating evidence-based policy making process. So that was the critical learning from this whole research, and we need to work with different stakeholders. So most of the frameworks and documents talk about interdisciplinary and multisectorality, and there are forums. So for example, there is a climate change technical working group at Ministry of Health, but other representatives from other sectors rarely do participate, or they do participate only on a token basis. So how can we make those meetings meaningful? So not just tokenistic representation, but actually making those meetings more fruitful and really working together. So not just being together, but working together is the key when we talk about climate and health related policy making. Thank you.